nutritionist. I'm here with Dr. Cynthia Fincher. We are here today to ask the question, what is autism?
Hi Elizabeth, thank you for setting up this production. We are hearing this term autism spectrum a lot, and it can be very confusing. I want to start out with a word called neurodiversity. And neurodiversity is saying that all of our brains are just a little bit different, that there's slight variation between all of us with our abilities, our experiences, opportunities, and that combination of life. So technically, any two brains are slightly neurodiverse. When we have bigger gaps in neurodiversity, if it's a larger distance between two different people, there's room for a lot more confusion. There's a very popular book that came out years ago called Men Are From Mars and Women Are From Venus, and psychologist John Gray talks about differences and maybe how you could understand a spouse coming from a very different angle, different point of view. And the idea is that we're not supposed to cure people. They're not supposed to quit being male or female, or a blend, but that they're not exactly the same. And so when we are talking about what we call neurotypical is going to be the standard that society is expecting of people. And when people have more neurodiversity, they may have more creativity, they may have different abilities, they may also have more of a struggle to manage things that most people call, quote, normal. So there can be things that are very difficult for one person, very easy for another person, and yet the person that struggles with one thing may be incredibly good at or regular abilities somewhere else. So what we found is that there are certain signs in young children that are warning us that they may be in what we're calling this autism spectrum. Now, the reason we're calling it a spectrum is because there's a lot of diversity within this. And there's so much confusion. Older people are confused because in the 60s, the word autism was used in a very limited way that referred to a very profound level of disability of people that would have to be in care, would never be independent. When we talk about the spectrum, what we're saying is people can have different abilities, different levels of intelligence, but where the challenge is in the social area. And what I want to say is that I like to say social finesse and mental flexibility. So the way that the Diagnostic and Statistical Manual defines autism spectrum disorder is persistent deficits in social communication across multiple contexts. So that's deficits in social emotional reciprocity, deficits in nonverbal communication behavior, deficits in developing and maintaining relationships. I like to summarize this as social finesse. The second area is restricted, repetitive patterns of behavior, interests, or activities. So that is stereotyped or repetitive speech, movement, or interests. Excessive adherence to routines, ritualized verbal or nonverbal behavior. Highly restricted fixated interests, intensity or focus. And hyper or hypo reactivity to sensory aspects of the environment. And we can think of the second half as that mental flexibility. So what people on the spectrum may report experiencing, starting at the very bottom of that definition, is that hyper or hypo-reactivity to sensory aspects of the environment. A lot of times we see this in young children where noises are very loud, that fabrics feel very intense to the skin, that textures of food become extremely important. Another thing we see is the very strict, narrow range of focus. So someone on the spectrum may be extremely interested in one topic and pretty much ignore a lot of other topics. There's a great deal of distress when you alter routines. They like predictable, fixed, expected things. And then some of the behaviors you may see, especially in young children, are repetitive, stereotyped speech, movements, or interests. what you're seeing socially is a lot of times kids that are very confused by how other kids just seem to know the social rules, just seem to know how to interact with each other. And they may be very interested in being friends, but not quite know what is being expected. The confusion comes in is that you can have kids that are very intelligent, maybe very advanced in reading or advanced in math, and yet they may not quite know how to follow instructions. And so if you think that the child is being bad, that the child is not trying, and you're saying to a kid, you're being bad, when in fact a child's doing the best they can, that can be very upsetting, traumatizing to the child. And so when you've got kids that are operating, I want to say it's a different operating system. And so it's not that we don't expect people to follow social rules, but we all know that there are different social rules for an automobile on the road than there are for a train on the train track. And so the car is able to stop suddenly, the car is able to make a right-hand turn, it can change direction, whereas the train is going to carry a whole lot of freight, but that train can't stop suddenly. The train can only run on the track between the stations. And so we would want both car drivers and train engineers to follow the rules of safety, but they're not quite identical rules. And so there can be a lot of misunderstanding between what is literally said versus various idioms that have more than one meaning. And English words and words in other language, they can have one word has more than one meaning. There can be expressions that have a connotation. And so this can be very confusing for a child who's trying to figure out in a very literal way things that are not completely expressed factually. And so there can be a lot of misunderstanding. One of the theories about autism spectrum is that the myelin sheath, and that is what covers the nerves in the brain, and very much like an electric wire that has a plastic coating, the plastic coating covers the wire. The myelin sheath puts coverage over the axons of the nerve, so they provide a protection. And without that protection in place, just like you can imagine getting an electric shock from a electric wire that doesn't have a good coating on it, the idea is that there may be some real shock for kiddos on the spectrum because they don't have enough myelin sheath. And that myelin sheath does not fully come into play until the age of 26. So we keep developing more myelin sheath, but that process isn't really finished until age 26. And so one of the things that people notice with young children is sometimes they have what you call a meltdown, where they become very extremely, not just a regular child temper tantrum, but beyond that, far more extreme. And kids either can become very aggressive or they become so devastated they just shut down inside. And so these meltdowns can be terrifying for child and for caregivers. It can be really confusing. And so then you have a choice. Do we say this is a child that's misbehaving, or do we say, hey, wait a minute, your brain is developing a little bit differently? Autism talks about a developmental delay, and that means that all of the stages of development are going to occur, but not at the same pace. And so we see this with all little kids. Some kids start running around, some kids start working on speaking, some kids sit and play with crafts. Every child has a lot of stuff to learn in the world, and kids come at that in a different sequence. They don't have to be even. Kids can become really strong in one area and then work on a different area. They don't have to work a little bit on all the different areas. And so when we're looking at a developmental delay, what that means is that we're going to see kids on the spectrum are coming to the milestones we expect at a different and a later age. And the general formula we would say is for kids on the autism spectrum, we would expect them to be about 2/3 of the social age. So if you've got a 12-year-old on autism, probably they're doing things that generally we would be seeing for a child that's 8. Or a 3-year-old would be operating at a 2-year-old level, a 6-year-old at a 4-year-old level. and a 24-year-old probably is operating at a 16-year-old level. So that the expectation between their functioning at skills or on academic tests and their social skills are not going to be the same.
So what does it mean when people talk about high functioning or low functioning?
Here's the deal. Autism is referring to the set of social skills, reading nonverbal clues. Some people like to call it common sense, which that's pretty controversial. Some people talk about emotional IQ. So how good someone is at reading social cues, that is where we get into this autism spectrum. Intelligence is a different measure. So when you have a highly intelligent person whose social skills are challenging, that's where we see something like this. The media favorite is Sheldon Cooper in The Big Bang Theory. And so when we see someone that's maybe an amazing surgeon, but pretty tacky, that is that split between the high IQ and the less impressive social skills. If you have someone who has very low social skills and very low intelligence, that's probably someone that's going to need some kind of ongoing care. They may live in an institution or have to have home services. They're not going to be able to function in the world. If you've got someone on the spectrum who has average IQ, which is where kind of most people are, they are not going to have this huge advantage intellectually, but they're still going to have to try to figure out how to manage in the social world. And so, sometimes we see, and then if you have some kind of low average IQ, a huge number of folks in that low average, are going to be at risk ending up in jail because they may not have really masterminded the crime or planned it, but they may be hanging around with someone that is exploiting them. So they may get caught. They may be standing in the wrong place at the wrong time. And so we are going to see in certain jail systems, we're going to see autism being overrepresented of people who are standing in the wrong place at the wrong time. There are certainly certain professions that are going to have a lot of folks on that spectrum. There's jokes about a lot of engineers, college professors, surgeons. Some of these jobs that require very specific, high-intensity focus, someone that's going to do great at staying super focused on their topic, well, they're not being distracted by all of the social cues and the social drama, and it both makes them strong in their area of focus, but it also can make it vulnerable in their personal lives.
Yeah.
So if we're going to rate how somebody's functioning, that certainly could be offensive to people, but people on the autism spectrum are at every part, at any level of the intellectual spectrum. So again, the big focus is on someone of a super high intelligence or a super low intelligence, but in fact, people with autism have the same range of all different levels of abilities like everybody else does.
This is Elizabeth Dennis with the Unstuck podcast. Please join us next time for more discussion with Dr. Cynthia Fincher.
Thank you, Elizabeth. I look forward to speaking to you more about these important topics of people on the autism spectrum.